Hi, I'm Tom Eichmann. I'm an orthopedic surgeon. I do specialize in hip and knee replacement, and I work at Cornerstone Orthopedics. I'm here today to talk to you just a little bit about knee and hip arthritis. It's very common in my practice to see patients in their 40s, 50s, and 60s with knee and hip arthritis. And one of the things that I like to recommend is cycling. Cycling is a great sport because it improves aerobic fitness, and it also promotes weight loss, both of which are very important for knee and hip arthritis. One of the things that's so advantageous about it is it unloads the joint. By putting weight on the handlebars and on the seat, you can get a great workout while not putting your full body weight on your knees and hips, unless you're standing up, which is a less frequent biking position. The other treatment modalities for arthritis include anti-inflammatories, cortisone injections, and one of the frequent things that we do is Euflexa injections for people who have mild to moderate arthritis, are not candidates for surgery, and this can be a helpful thing to get people back on the road and keep them active in their sport. That's one of our main goals at Cornerstone Orthopedics.
Hello, I'm Dr. Daniel Osell from Cornerstone Orthopedics and Sports Medicine. I specialize in the treatment of foot and ankle injuries in the professional and recreational athlete, probably the most common of which is the ankle sprain. When I really talk about ankle sprains, a lot of people think that these common injuries, the most common sporting injury, is something that can just be treated conservatively at home, and oftentimes, if left untreated, this can lead to devastating and really frustrating results with the foot and ankle. When I specifically talk about ankle sprains, I grade the ankle sprains as grade 1, grade 2, or grade 3, or what I like to call my Clint Eastwood classification: the good, the bad, and the ugly. So when we talk about these grade 1 to grade 3 ankle sprains, we're talking about ligaments and tearing of the ligaments. Oftentimes, these tearing of the ligaments can heal up conservatively with short periods of immobilization, anti-inflammatory medication, and most importantly, physical therapy. In multiple studies done on ankle sprains, 70% of the ugly or the grade 3 ankle sprains, where both ligaments are completely torn, heal up without any type of surgical intervention. However, proper monitoring and treatment of this ankle sprain is imperative. Now, if left untreated for a long period of time, the ankle sprain can turn into a situation that we call instability. The only reason that those ligaments exist is to protect the cartilage inside of the ankle. And if the cartilage gets damaged inside the ankle, this leads to something that we call arthritis. And arthritis of the ankle is very difficult to treat. It's not like arthritis of other joints where we can do hip replacements or knee replacements that we've talked about before. It's something that is very difficult to treat. So we like to be in the profession of prevention of the progression of arthritis. So when we talk about ankle instability, as you can see right here, the ligaments, if left unstable, the ankle tilts out of joint. And this can create a situation where pressures in one part of the ankle are more than in other parts of the ankle. And this can create a situation where the cartilage gets worn away or damaged. If the cartilage gets worn away or damaged, that can lead to full thickness defects within that cartilage, which are nearly impossible to treat. Now, the surgical treatment of chronic ankle instability is a wonderful procedure. It's called the Brostrom procedure, and it's the best ligament reconstruction going in orthopedics. It's an anatomic reconstruction, and it has the athlete back to cutting and pivoting sports within about 3 months. So when we do the procedure to stabilize that ankle, we go in there, we repair those ligaments back to the anatomic position that they were put in the first place. The ankle is stabilized, the cartilage is protected. We rehab that ankle over a period of 8 weeks, and usually by that 3-month point post-operatively, I have my athletes back to cutting, pivoting, running, and sporting activities, both professional and recreational athletes. So it's important to be seen properly for these ankle sprains and get them appropriately treated for an excellent outcome.
Injuries about the shoulder are common in sports. They can occur both by collision and by falls, such as off a bicycle. These injuries are commonly can be associated with soft tissue injury involving the rotator cuff, or even fractures involving the upper part of the humerus and the clavicle. Most fractures can be managed non-operatively, but occasionally displaced fractures can lead to delayed healing and possible impairment for the long term. Because of this, surgery may be indicated for some of these fractures. Fractures of the clavicle and upper end or proximal side of the humerus are common. As shown here in this radiograph, this is a normal clavicle that is intact. The next radiograph shows a fracture with some displacement in the clavicle. This may require open reduction internal fixation, which can be performed with a plate, as in this picture here. Fractures of the proximal humerus or more near the shoulder. Any displacement of those fractures can require surgery as well. And again, a plate and screws can be utilized as shown here. A consultation with an orthopedic surgeon who specializes in upper extremity fractures would be appropriate. Radiographs are commonly taken to further evaluate the fracture. Either treated operatively or non-operatively, these fractures will take 8 to 10 weeks to heal, with return to activities in 10 to 12 weeks.